If you are looking to be tested with the blood test or the serological assay, I would recommend waiting at least 2 weeks because it takes the body about that long to develop antibodies.
Okay, so there is a shorter swab that's been recommended for nasal swabbing and home testing. That was tested by the university, and what I'm opening now is the swab that we use, which is a longer but thin and flexible swab that has a very soft, these have either a Dacron or a nylon tip. So they're very soft, but these very thin profile swabs are what we use. The reason we use these, first of all, we do only nasopharyngeal testing. That means I won't do this in my nose, in my nostril, but we go through the nostril and put it back close to the external opening of the ear, and that puts it up against the back of where the nose meets the throat. It's called the nasopharynx. And the studies that have been done show that that's the best place to get an accurate sample. This has been compared in one study at the university to nasal swabs or tongue swabs. And the rate of positivity is better with the nasopharyngeal swab. It's similar in just the nasal swab that just goes a bit into the nose, but not all the way back. If you take a large quantity of patients, it has about a 96% as opposed to a 98 to 99% likelihood of getting a true positive result. But we don't want to take any chances here. And we want to make sure that everyone is screened as effectively as possible. And so we use this swab, and we've had very good results with this.
It would make a new vaccine development very tricky because the targets are moving at that point, which is what we see with influenza, which means we would have to have multiple vaccines covering multiple substrains of the coronavirus. So it would just add more complexity to the development of a vaccine.
First of all, there are no either prescription or over-the-counter medications or drugs that help prevent COVID that have been shown to be effective in treating COVID, and that's the case for hydroxychloroquine that was initially thought to maybe show some promise. Alcohol, which has been touted as being effective for prevention. Nope, sorry. Lysol or any ingested cleaning product or bleach obviously is not a good idea. There is some positive effect that's been shown by remdesivir, which is a medication given in the hospital to patients who have severe COVID illness, and that has shown some effect in shortening the course of the illness, not in curing it, or it's not a miracle panacea. Other myths, warm weather or cold weather will prevent COVID. That has not been shown to be the case. COVID virus infections have occurred in tropical climate as well as subarctic conditions, so no dice there. One other myth or question, valid question, do I need to wear a mask when I exercise? And first of all, there is no effect on lowering oxygen or increasing dramatically carbon dioxide retention in the system or lowering our oxygen level using a mask. However, it is pretty uncomfortable to wear a mask when you're exercising. It makes it a little bit hard to mechanically get the air exchange. And also, there is a lot of moisture that builds up in the mask, making it less effective and a little more prone to other bacterial growth. So in general, if you are exercising, first of all, you want to be in a space that is very, you want to be away from other people, first of all, if you're indoors. If you're out of doors, it is okay to exercise without a mask, particularly if you can maintain a distance of at least, World Health Organization says a meter. You know, we use the 6-foot rule. Meter is a little less than that, but if you're moving and others are moving and you're not in close contact for a persistent period of time, that is safe and you don't need to mask up. One other myth was that if I am intubated, if I'm severely ill and I get intubated, it's pretty much assured that I will die, and that is not the case. And I will say proudly, particularly at Overlake, we have had excellent success in getting patients extubated, and our rate of getting patients extubated is almost double the rate that has been published worldwide and nationwide. So I don't want people to worry about that. If you get severely ill, this is a good place to be treated.
That is a good question. We do not know at this time the true immunity protections we have. My suspicion is it is not a lifelong immunity, just based on other coronaviruses that circulate during the fall season with influenza. So I suspect it would be a situation where you could get it again maybe a year from the time of getting the initial infection.
Well, that is dependent in part on the severity of the illness, obviously, and somewhat on the age of the patient. So we have typically, first of all, most patients get discharged. Most patients don't even need to be in the hospital. And a lot of patients have mild symptoms and just stay at home. Those that have the virus, the typical course is 7 to 10 days. Recovery, you can define that various ways, but the strict definition of that is 2 consecutive negative swabs for COVID. And that may take a bit longer, up to 2 weeks. And most people will recover without any lasting side effect from COVID. Now, if the infection is severe, there can be some lasting effect in various organs, such as in the lungs. That's typically kind of the most severely affected of the body organs. There can be some lasting scarring in the lungs that has been reported. Some patients may have what's called myocarditis, which is an inflammation of the heart muscle. That can cause fairly significant impairment of the squeezing function, of the pumping function of the heart. But often this will resolve. Occasionally there will be persistent effect on the heart. The same is true for some other organs. For the brain, there can be some neurologic sequelae. Most of the severe cases have been found to actually have low oxygen effect on the brain. So it's not actually an inflammation or infection of the brain tissue that causes the injury to the brain. It's low oxygen. Sometimes we just can't get enough oxygen into the system to keep the brain that functions on oxygen adequately supplied. And those are probably the more common persistent effects. Most people, however, will recover without any lasting effect in 7 to 10 days.